وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم وبارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم في العالمين إنك حميد مجيد. اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة وابعثه مقاما محمودا الذي وعدته. اللهم آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. اللهم بك نحيا وبك نموت وإليك المصير. رضينا بالله ربا وبالإسلام دينا وبمحمد صلى الله.
This Azan is sponsored by UK Islamic Mission, serving humanity since 1962.
Every day is a lesson, and everything you do defines.
Hello, Assalamu alaikum. This is your very own Doctor Shabina for Salaam Radio 106.2 FM, and I'm broadcasting live from Peterborough 106.2 FM, and also on YouTube Live, Twitter Live, Facebook Live. It's wonderful to have you all here on board with us today for another fun-packed, informative health show. And I've got a wonderful lineup of guests today with me. Hopefully, we were having a few technical difficulties in trying to get her on board with a video call. Unfortunately, there's a problem with the technology and a problem in the Wi-Fi that we've got over here. So we're going to hopefully take her on call. Now, our program is an extremely informative one. It's an important one about the importance of breast cancer. And my guest is Dr. Sadaf Jafferbhoy. Dr. Sadaf Jafferbhoy was trained in the West Midlands, where she completed her higher surgical training in general surgery.
24 hours a day, 365 days a year. This is Salaam Radio.
Well, we were interrupted by the jingle just there, which isn't a problem, but that's not a problem. We can still carry on with our show, it's the Body, Health and Mind show. I am Dr. Shabina. I'm a full-time GP who works here in the heart of Peterborough in a busy inner city practice, and I bring to you every single week shows that are pertinent to the community, to health problems within the community, and that is the reason why we want you to listen to create awareness of all these shows. Now, I've got a wonderful guest online with me. Her name is Dr. Sadaf Jafferbhoy. She was trained in the West Midlands, where she completed her higher surgical training in general surgery and a subspecialist interest in breast and oncoplastic surgery. She's currently doing her fellowship in oncoplastic surgery in the Nightingale and Genesis Prevention Centre at Wythenshawe Hospital. She specialises in treating breast cancer using oncoplastic techniques. Her routine work also involves risk-reducing surgery for high-risk breast cancer patients. She's a fellow of the Royal College of Surgeons of England, a member of the Association of Breast Surgery, British Association of the Surgical Society, and Women in Surgical Training. And we are going to bring her online. Dr. Jafferbhoy, Assalamu alaikum.
Assalamu alaikum, Dr. Shabina. Thank you for the kind introduction.
Not at all. It's wonderful to have you on board. I hope you're not feeling shy.
Not at all.
It's wonderful to have you on board here, and it's wonderful to have you on the show. Do excuse us for the fact that we've got a problem with the video, but we will get you on next time, and we will have your video on board. But it's wonderful to have you here in the live on our studio, and I've given an introduction about you having this subspecialist interest in oncoplastic breast surgery. Now, would you like to tell our listeners a little bit about what that is all about and what it entails, please?
So oncoplastic surgery is what we say modern breast surgery,
Okay.
which is dealing with not only the cancer bit of the breast, but also addressing to the cosmetic outcome.
Okay.
So in nutshell, what oncoplastic surgery involves, onco means cancer, and plastic is, of course, the aesthetic or the cosmetic surgery.
Right.
So oncoplastic surgery includes both. So I deal with ladies who've got breast cancer. I treat them, offer them surgery, but also addressing the cosmetic outcomes. So for instance, if a lady ends up with a lumpectomy, I then mobilize or bring the tissue from the surrounding area to fill the defect from where the lump has been taken out.
Okay. Okay.
Or if the lady needs a mastectomy, we do it in such a way that we can reconstruct the breast
Okay.
and make it look more natural.
Right. Okay. But that sounds extremely interesting, I must say. Can I ask, oncoplastic surgery itself, because you're talking a little bit more about the cosmesis of the outcome of such surgery, is this something that is practiced in specialist centres, or does every hospital within the UK have areas of oncoplastic surgery?
So now pretty much all the breast surgeons who are coming up and practicing within the UK are trained to do these kind of oncoplastic procedures. Some do more than the others.
Right.
I have to say some of the surgeons who had been practicing for quite some time, who were trained as general surgeons and continue to do the general surgical work along with breast, there are some out there who would not do as much oncoplastic work as compared to the newer surgeons.
Broadcasting 24 hours a day, 365 days a year. This is Salaam Radio.
But the surgeons who have been trained more so in the recent era, what I'm saying is in the last sort of 6-10 years, they're all trained to do these kind of procedures.
Right. Okay. So it's a very niche area, because we know obviously that women differ in shape, size, obviously body demographic, the way it is, and obviously ethnicity. You have different skin colours and skin characteristics, and that all needs to be taken into consideration, doesn't it?
Oh, absolutely. And this is something that we always warn ladies about. That yes, no matter we try and match them, that we call as symmetrizing surgery, or minimize the cosmetic defects following the surgery, but every procedure is not for one patient, and likewise it has to be everything needs to be taken into account, like you quite rightly said, the ethnicity, what the breast shape is, what the size is, and more importantly, what the patient is expecting from us.
Yeah. Okay, so you actually can sit down and have a consultation with a patient as to what their expectations are, and whether you can fulfill those expectations.
Oh, absolutely, because the more surgery we do, sometimes there are more complications associated with that. So everything is taken into consideration. It may be that one patient is not fit for that kind of an operation, because that may be that it is a longer procedure, and some patients may just want the simplest possible operation to get rid of the cancer. So everyone is different, and when we sit down and do the consultation with them, it's a lot of detailed discussion that comes into play as to what we can offer and what they want from us, and discussing all the complications associated with each and every individual procedure.
Okay. Now, Dr. Jafferbhoy, I'd like to really ask you, what inclined you to take up this particular field of breast surgery? We know that there are lots of surgery in itself is quite innovative, and the various surgical techniques that are employed in this particular area are obviously highly specialised. But what instilled it in you to take up this, what I would call a niche specialism in this aspect of breast surgery? I'd be interested to know.
So I always wanted to be a surgeon. So when I took my general surgical training, which is what all surgeons are expected to do, irrespective of whether they would want to do vascular or breast. This was back in the days when I was trained.
Okay.
So I got into the general surgical training about 6-7 years ago. And as I did more and more of different specialties, which included GI work, vascular, And then finally, when I got into breast, and I really liked it, I thought, well, it's not only dealing with cancer, but also addressing the cosmetic outcome. And this was something, which is more, which is a very different kind of surgery, as compared to what generally most of the general surgeons would do, because most of the general surgeons, by definition, they're trained to do all kind of general surgery, which includes bowel work. And I thought, well, this is very different, and most of my patients, as you would expect, are ladies.
Yeah.
And so not only, dealing with the surgical aspect, but there's a lot of emotional aspects that we have to address too when we see these patients in our clinic. And I thought, this is something different as compared to, what generally people think about surgeons, that all they can do is cut patients out and do the operations. And I thought, well, actually, you know what? Yes, I want to do that bit, but also I want to have, include the cosmetic side of things to my surgery and, deal with more women. And I have to say, the more and more I see patients, and I feel they're more comfortable when they come and see a female doctor in clinic.
Of course.
So
yes.
it's very reassuring, what I can offer and what they can take from me.
Of course. And I think that a lot of the time we will see, especially within the Asian demographic, we will always have the fact that there is somebody that will want, as particularly females, Asian females themselves, they will want to consult with a female about the ensuing treatment. It's a very personal thing to have to talk about breast surgery. So I would most definitely endorse the fact that you give a choice to the patient as well. Now, Dr. Jafferbhoy, and for those of you that have just tuned in, this is the Body, Health and Mind Show with Dr. Shabina Asad-Qiyu. My special guest is Dr. Sadaf Jafferbhoy, who is trained in the West Midlands, and she specialises in treating breast cancer using oncoplastic techniques, and her routine work also involves risk-reducing surgery for high-risk breast cancer patients. If you'd like to call us, you're most welcome to do so on the Salaam Radio studio number of 01733 602133, or you can text and WhatsApp us on 07745 278 978, or you can ask questions underneath the Facebook live video, which would be very happy to answer. So, Dr. Jafferbhoy, obviously going back to talking a little bit about this now, screening. This is the first preventative tool introduced by the NHS to talk a little bit and to make us aware a little bit of the importance of screening in I wouldn't say prevention, but to identify risks of an individual developing breast cancer. Now, could you give us a little bit in terms of statistics of the prevalence of breast cancer here within the United Kingdom?
So in the UK, we know the prevalence of breast cancer is very high. And we say generally 1 in 8 ladies do get breast cancer.
Wow.
Which is quite a high number. If you sort of sit in a small group of ladies and you've got 8 of them, and you think that one of them may end up having a cancer, and they will do. So the whole idea of breast screening is not, like you quite rightly said, to prevent breast cancer, but to identify it at a very early stage, or at a stage where it is in the situation where it is pre-invasive, that we call as an in situ cancer, which means the cancer has not formed to that degree that it will spread anywhere else, including into the lymph nodes. Now, this is we call as an in situ cancer, or commonly we call as in short term as DCIS, which means ductal carcinoma in situ.
Okay.
So this is detected most commonly by screening mammograms.
Right.
And what the screening mammograms do is they pick up those DCIS and by showing the calcification. So on mammograms, generally DCIS represents as area of microcalcifications. Micro means small, calcifications means the areas which have got lots of calcium deposits in it.
Right.
And this is how DCIS is shown up on mammograms.
Okay.
So because these are the changes that any normal person will not be able to feel, and hence screening mammograms come into play. So in the UK, all ladies between the age of 50 and 70 are invited to have screening mammograms,
Okay.
which are x-rays of the breast. So 2 x-rays of each breast, which means 4 x-rays altogether. And they are done every 3 years.
Right. Okay.
So going back onto the question, so of the screening ladies that we see, we say out of the 100 ladies that we would screen, 4 of them will be called back to have further assessment.
Right.
I to say if the radiologists who are the specialist x-ray doctors, when they look at the mammograms and are not quite so sure about it, sometimes they need further x-rays or an ultrasound scan or some kind of an assessment to clarify the abnormality that they see on the mammograms.
Okay.
And out of those 4, 3 ladies would be fine, but 1 of them probably will have cancer.
Right. Okay. Okay. And that is why it is so important for ladies to attend their mammograms. If you just tuned in, we have Dr. Sadaf Jafferbhoy, who specialises in breast oncoplastic surgery and is talking a little bit about the screening prevalence and what the importance of screening and the types of cancer that can be picked up by screening, as you named that as ductal carcinoma in situ. And it's important, isn't it, Dr. Jafferbhoy, to actually spread the message as to how important, on the basis of the prevalence and occurrence of breast cancer, how important it is to attend your screening appointments, given that it's completely free of charge here on the NHS.
Yes, indeed. I think we are very lucky to have that service available in the NHS free of charge. And the whole idea is to pick cancers up at a very, very early stage. And the whole idea about screening is when cancers are picked up at such an early stage, the survival rate is much higher, which means that if a lady who's been diagnosed with cancer through screening mammogram, overall they do much, much better as compared to a lady who comes to clinic with having some troubles, i.e. feeling a lump in their breast.
Right, okay.
So, yes, it is crucial, and hence the government is taking steps to increase the age limit for screening mammograms. There may be some ladies out there who have had mammograms from the age of 47, and that is a part of the trial that the government is planning to put forward. So anyone above the age of 47 will get an automatic recall for a mammogram. So first mammogram as 47, and then after every 3 years.
Okay, okay.
And I must say, ladies out there who are above the age of 70, they may be called up to the age of 73 to have their mammograms. And if they are beyond 73 or beyond the age of 70, depending on the area where they live, and if they want to have a mammogram done, they can always ring up the local screening unit and ask for a mammogram if they haven't had a mammogram for the last 3 years.
Okay. Now,
Yes,
sorry, you were finishing.
No, so I'm just saying we are indeed very lucky to have that service, and we should make the most of it while it is available in the NHS.
Yes, that's right. And coming on to a lot of what you've said, and I completely endorse that, because we have a massive program in public health. Every city has its own public health organisation that wants to assert the message how important all types of screening are, especially breast screening. And if you've tuned in, this is Salaam Radio, Dr. Shabina Siddique's Body, Health and Mind show. And I have the wonderful Dr. Sadaf Jafferbhoy, who specialises in breast and oncoplastic surgery, with us today, giving us her very valuable time and telling us about the relevance of screening. And what I guess the other question I'd like to ask you, Dr. Jafferbhoy, from our conversation and leading up to that, is that it's important to assert the fact, isn't it, that between the 3 years, how important it is to examine the breasts for lumps for women as well. Because if they do find a lump, they shouldn't wait for their screening appointment. They should straight away go to be seen by a GP.
I could not agree more with you on this one, because a screening is just like having an MOT of the car. So once you've had an MOT of the car may be in a perfect state, and so might have been the breast when the screening mammograms have happened.
Right. Okay.
So it is very, very important that ladies keep an eye on their breast, and we generally advise ladies to examine their breast themselves. And I'll come to that in a minute as to how the examination should be carried out.
Okay.
So when they notice, and if they notice a lump, you quite rightly said they don't have to wait for a mammogram, even if they've had a mammogram in the last few months or so. If they notice anything different in their breast, they need to see their GP, and the GP can decide whether they need to be seen in the breast clinic or not.
Right.
But it is crucial that they should seek medical advice if they have any concerns about their breast.
Right.
Now, like I said, so breast examination, we do see lots and lots of ladies who would come to clinic, and just because they cannot examine themselves properly, and they don't know what to feel for and what to expect and what is normal and what is not normal. So the general advice to all the ladies is please examine your breast. And because one knows their body the best as compared to anyone else.
Sure.
And the way to examine the breast would be like any other doctor would do. So stand in front of the mirror and have a look at your breast.
Okay.
Of course, having had your clothes off.
Of course, of course.
So, and the way to look at the breast would be just to keep the arms by your side and have a look on the skin. And what you're looking for is, are there any changes in the color of the skin? How does the nipple look like? Is the nipple out? Has it gone in? Some ladies may have what we call as inverted nipples, which means that the nipples have always been in. If you've had it for a long time and you've seen a doctor regarding this, that's absolutely fine. But if it is something new, they need to go and see the doctor. So having a look and looking for any changes in the shape of the breast, so something new that has developed. So that is done while the arms are by the side, and they need to raise their arms up. And when they do that, they need to see what we call as dimpling, i.e. to see, is the skin getting slightly pulled in when they raise their arms? And they need to have a look on both their breast up to the armpit. So that's the second step. And the third thing, what I always advise to the ladies is to put their hands on their waist.
Okay.
And push their hands in and see if there are any differences in the shape of the breast. So those are the things to look out for when they are looking at the breast. And this is not talking about feeling the breast. This is just on looking at the breast.
Okay. Okay.
Then it comes to having a gentle feel of the breast. And it's always, so don't examine the breast while you're sat up. It's always best to lie down, put your arm behind your head, and with the other hand, you should examine your breast. Just with the flat of your hand. Do not dig into the breast tissue with the tips of your fingers.
Okay.
And if you do that, all the breast tissue will feel lumpy.
That's right, yes.
So that is the key thing, and that is very important. Not to dig the fingers in, but just with the flat of the palm, one has to examine the breast tissue. And you need to do on both sides, and you need to feel for any lumps.
Okay.
When you do that. And then so other thing I would always say to ladies is, don't squeeze your nipples.
Okay.
Some ladies would have the tendency to squeeze the nipples to see if there is anything coming out.
Right. Okay.
So not to squeeze the nipple. If there is any discharge coming out from the nipple without squeezing it, then you should seek medical advice.
Right. Okay.
And that is the difference. If anyone keeps on squeezing the nipple and notice discharge, that's not as worrying as a discharge that comes out from the nipple without squeezing it.
Right. Okay. Okay. So you've made actually that quite clear, and this is something that we really haven't spoken about before on the show, Dr. Jafferbhoy, the aspect of having a proper examination. And Dr. Jafferbhoy is exactly right, talking about how one should first of all inspect the skin of the breast, look at the symmetry of the breast, and then obviously how to examine the breast with the flat of your hand and not to dig your fingers in, because throughout various phases of your cycle, from a female perspective, the changes in the breast do take place because they're influenced by hormones, and that can give you this feeling of lumpiness if you use your fingers or dig them in. So some really pertinent views and instructions here. We are actually 60 seconds to a break. I'm going to read out some of what the listeners have said. So we have Sister Shazia Bashir. Salam, my beautiful sister. Wa alaikum as-salam. Thank you very much for joining us on the show. We have Sister Noreen B, who's all the way in Pakistan. Salam alaikum, sister. Watching and listening to you from Pakistan. Thank you very much. It's wonderful and heartwarming to hear that you've tuned in from Pakistan. We also have a Mr. Sami Hussain. Assalamu alaikum. Wa alaikum as-salam. And we have a brother Adzfaz who's watching us from Cromwell Road, which happens to be just across the road. So thank you very much for your support. And actually, I think it's quite heartwarming that there are quite a few men that have tuned in that want to listen about the relevance of this. But Dr. Jafferbhoy, please don't disconnect. We will connect with you in approximately just 4 minutes after the break. And please stay tuned, because you're an absolutely wonderful specialist giving a lot of therapeutic
Stay tuned
advice.
to Salaam Radio after this short ad break.
It doesn't take much to bring some difference. You give some change, which makes a change. Because nothing gets mileage like a charity. Just a little change turns into a chain. And before we know it, the results are massive. So give a little to make a big difference. For donations, call now. UKIM 0207 387 2157.
With our friends at Salaam Radio, ESP Magazine and Vivacity,
we're looking for new voices
at BBC Radio Cambridgeshire.
You don't need any broadcasting experience.
Just a great personality and a story to tell.
We're holding open auditions this Saturday afternoon from 3:30
at the Key Theatre in Peterborough.
This is your chance to get your foot in the door at the BBC.
Your voice.
Your voice.
Your voice. Your voice.
Could be our new voice.
For more details,
go to
bbc.co.uk/new voices.
New voices.
BBC Radio Cambridgeshire.
Had a car accident or an accident at work? Accident specialists are experts in no-win, no-fee accident claims. Leave the hassle to us. Our multilingual settlement experts will manage the entire claims process on your behalf, with nothing to pay up front. We provide services such as credit hire, taxi vehicles, recovery, storage and much more. For full details on our range of services and a free consultation, call us on 01733 555 774 or visit our office at 249 Lincoln Road opposite the NatWest Bank. Accident Specialists. Start your successful claim today.
Almarad Tiles. With over 70 stores nationwide, we are now open in Peterborough. Up to 50% discount offers now on. Largest selection of tiles. Full bathroom suites from only £189. Paint, LED lighting, laminate flooring from only £7.99. Over 1,000 designs of wallpaper in stock. We have everything you need. Come and visit us at 193 Fengate, Peterborough, PE1 5BH, or call us on 01733 34 58 47. Almarad Tiles, now open.
Do you own a restaurant or takeaway? Cater Fair is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices. or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
दोस्ता कियां परेशान है
जरा कर है ना सारा सौदा मुक्या वा मुल्का विच पैसे भेजने
हूं नहीं मार फूड वाले की फोन खड़का ते फ्री लोकल डिलीवरी कार मंगवा
अला ता उथे कै स्पेशल आ
उना की लबाई हाइजीन च ग्रेड 5 चीज़ां चंगियां मियारी ते सस्तियां ते नाले ऑफरां ही ऑफरां
और क्या
ताजा गोश्त ताजी सब्जियां ते फ्रूट आटा चावल दालां मसाले ते जूस सारे बिल जमा करने गैस ते इलेक्ट्रिक नो टॉप अप भी करने पाकिस्तान पैसे बिल्कुल फ्री भेजने मतलब के एक चिड़ी ने दूध छड़ी ते हर शै लबनी
जने ने आप उतरा
Amar Food Store and Halal Meat 613B Lincoln Road Peterborough telephone 01733 687374.
Celebrate the praises of thy Lord and pray for his forgiveness, for he is oft returning in grace.
Broadcasting 24 hours a day, 365 days a year. This is Salaam Radio.
Assalamu alaikum and welcome back to the Body Health and Mind Show with Dr. Shabina Asad Qayyum on Salaam Radio 106.2 FM. We are indeed having a wonderfully interest-packed generated show with a wonderful specialist who I'm going to introduce once again. Before I go on, I did promise I would give a couple of children some shout-outs. So we have a wonderful young boy called Zach, who has joined us in today's show. I'd like us all to welcome him on board the Salaam Radio family and hope that he has a wonderful time with us and gets to learn something if his interest is obviously in the media, which we will talk a little bit about towards the end. And we also had lovely two girls. Now, I'm so terrible with names, but I remember Iman, and they are actually Sister Michelle's daughters, and they're wonderful little daughters. And her 7-year-old daughter was stood here in front of me, and she told me her name, and she told me her sister's name as well. And I've forgotten her name, and I've remembered her sister's name. So please do forgive me. But this is a shout out to your show, for my show. From me to you. You're ever such a good girl. You came in and you were well behaved, and you know what I could well do with sitting you down next to me and broadcasting a show next to me, because you did not want to leave, did you? Yes, you were enjoying our company. So thank you very much for all tuning in on this very informative Pack Body Health and Mind show. And I have with me Doctor Sadaf Jafferbhoy, who is a specialist in breast oncoplastic surgery. Assalamu alaikum, Dr. Jafferbhoy.
Assalamu alaikum, Dr. Shabina.
How are you? Are you still with us?
I am indeed.
Yes, and I hope you're enjoying the show.
Oh, absolutely. Every second of it.
Well, we've got a lot of interest that is being engaged, and we're having a few questions as well. But you were talking about a very important aspect of obviously screening, obviously how to examine, and the fact how important it is to go to your GP if you do identify a lump, on the method of examination, or maybe not, but however you have described. Now, let's talk a little bit about risk factors for breast cancer, Dr. Jafferbhoy. Would you like to tell our listeners a little bit about the risk factors that could put you at slightly higher risk of developing breast cancer?
So, the risk of breast cancer, like we say, is multifactorial. There are many factors that can come into play which can increase one's risk of having breast cancer. So exposure to estrogen hormones, which is a female hormone that generally all ladies would have because it comes from the ovaries. So any lady who's had a menarche, which we say it's when their periods start at a young age. And I say young age, I mean to say before the age of 13. Or they've had a late menopause.
Right.
So anyone who's had periods for a long period of time, they are at a high risk of developing cancer. But the risk of it is relatively small.
Right.
Then we come into having children. So ladies who don't have children, again, their risk is slightly higher as compared to someone who has got children. Or someone who's had children after the age of 30.
Right.
So anyone who's had the first child after the age of 30, her risk is slightly higher as compared to someone who's had the first child at a younger age.
Right.
And there is good evidence to say that breastfeeding reduces the risk of breast cancer.
Okay.
And it's not breastfeeding for a few weeks or few days. So breastfeeding up to 2 years reduces the risk of breast cancer.
Right. Okay.
And then we fall into a big category of family members being affected with breast cancer.
Sure.
So ladies who've had their close family members who've been treated for breast cancer or cancer of the ovaries, they may be slightly at a higher risk.
Yeah.
But family, when I say family members, it doesn't mean great-great-aunts, great-grandmothers. I'm talking about closer relatives, i.e. mother, daughter, sister, aunts, if there are few aunts who've been treated for breast or cancer of the ovaries. And it's just not on the mother's side. It's the family members on the father's side. They can influence one's risk of having breast cancer.
Okay, that makes that quite clear, because we do often get patients within primary care who will say, well, actually, you know, my grandmother's sister, for example, had breast cancer and I want to be referred to a geneticist. But when you further inquire as to whether their mothers or their maternal aunties had breast cancer, the answer is in negative, or even their sisters. So you would not quantify that to be a base to refer simply because they don't, or if they don't have any symptoms, simply because of that. What are your thoughts on that?
So no, so if anyone like third degree relatives, from what you're saying, they do not fall into the criteria for being referred to the family history clinic. So the ones that the primary care physicians or the GPs would refer patients to a family history clinic or to a genetics clinic is whereby there are lots of family members who have been affected with breast cancer, or a first degree relative. And let me make this clear. So first degree relatives would be mother, sister, daughter. So if they have been treated for breast cancer at a young age, i.e. less than the age of 40, they would qualify for the criteria to be referred to the family history clinic. Or, again, a first degree relative who's had cancer on both sides, or a first degree relative who's had breast cancer or ovarian cancer, and another relative, either first degree or second degree, who has had another breast cancer or ovarian cancer.
Okay.
So there are very specific criteria as to who needs to be referred to the family history clinic.
Okay.
And again, one thing that is quite important, although breast cancer in male patients is rare, but it can still happen. So anyone who's got a male family member who's a first degree relative and has been treated for breast cancer, they would fulfill the criteria to be referred to the family history clinic.
Okay.
So,
And that's one thing that we don't often talk about, is male breast cancer as well. I suppose we'd need a part of a show for that. But would you like to briefly elaborate on male breast problems? Is that something that you work in? I mean, would men need the same reconstructive surgery from an oncoplastic perspective like females do?
So, no. The answer is because, as we all know, male patients do not have that much breast tissue.
Right.
That's one. And if any male patient develops a cancer, they end up having the whole breast removed, which is what we call as a mastectomy.
Right.
So male breast cancer, it is rare, but out of the 100 cancers which we would see, 99 of our patients would be women, but there would be one man.
Right.
So it does happen, it can happen. And again, like we say to our female patients, if male patients do find a lump, the advice is exactly the same. They should not wait for anything. They should just go and see their GP.
Sure. Okay, so that's an important message for males as well. Now, we have a couple of questions that popped up on my personal phone, and all of the questions have asked for anonymity as to what their names are, which we will be respectful of. But I have a sister who has asked that if breast reconstructive surgery takes place as a result of a lumpectomy on one breast, is it true that the other breast can also be operated upon to maintain symmetry, or no?
Just to clarify, I think there was some problem with the connection. So someone has said they've had a lumpectomy for cancer.
So they wanted to ask that with a lumpectomy for cancer, if breast reconstructive surgery is being offered on the affected breast, if it disturbs the symmetry of both breasts, are both breasts then operated upon to achieve symmetry, or is it only the breast that is operated upon?
So again, depends if the side that has been treated for breast cancer, it depends what the degree of asymmetry is.
Okay.
And what we want to achieve. Say, for instance, if by losing some volume on one side of the breast, if you can replace that volume either by bringing tissue from the side or from below the breast, or getting some fat from the tummy or thighs, and you can fill that defect, that is an option.
Okay.
But if that is not possible and the lady wants to get smaller on the other side, and the other option may be to reduce the untreated side, just to match the two sides together.
Okay, so that option is available?
It is. Okay. But like I said right at the beginning of the conversation, every procedure is not for every patient.
Of course, and that's very important to ascertain what the ideas, concerns and expectations are of each patient. In line of that, the same the same listener has asked that if an individual were to have a mastectomy and to have breast reconstructive surgery, is it imperative then to have surgery on the other breast? I think the answer would be pretty much the same, wouldn't it?
No, because this is the other side. Of course, it's not a cancer operation where you have to have anything done. And symmetrizing surgery or anything that's related to cosmesis, it's entirely dependent on the patient. And of course, what is a feasible surgical option. So no, the answer to it is no. If you don't want to have a surgery done on the other side, you shouldn't have it done.
Okay. And somebody else has asked me that obviously with implants may be placed in for breast reconstructive surgery purposes, may I please ask whether there is a risk of developing further cancer as a result of implants being placed in? That's a good question, actually.
It is, and this is a very hot topic against lots of plastic surgeons and breast surgeons, and I'm sure, Dr. Shabina, you would have come across many of these requests in your practice. So as we are getting more and more awareness with regards to breast implants, there is a rare kind of lymphoma associated with breast implants.
Okay.
The medical term for it is anaplastic large cell lymphoma, which in short form we call as ALCL. So that's not breast cancer, and lymphoma is a completely different aspect of cancer which comes from the lymph glands. Now, of the thousands and thousands of ladies who've had implants put in, the number of ladies having had this problem is relatively very, very small. So all the ladies now who have implants put in, they are warned about the risk because we know that this is associated with implants.
Okay.
Although the risk is small and it is not a breast cancer.
Sure.
So sometimes ladies may develop a swelling out of the blue on their breast, which has got an implant in, and those are the things to look out for. So, or if one notices a lump in the breast, or they notice that the breast has become swollen, they should go and see a GP. And of course, I'm sure the GP would send them to their local breast clinic.
Yeah, I think you've given some really actually practical and some really sensible answers to a lot of what our viewers have asked. I have a question from quite a concerned listener of mine who said that I was diagnosed with breast cancer in 2005 when I lived in a different part of the country. I was placed on tamoxifen for a year. I underwent a mastectomy, but no breast reconstruction surgery was ever offered to me. In the meantime, I moved. I'm still to remain on tamoxifen therapy until is otherwise advised by my specialist. But I would like to know, why is it that I have to live without one breast, and it has had a massive impact on my emotional well-being? Is there any way my GP can refer me for the same? That's very sad.
It is very sad because, and of course, I don't know what the details were and what, why was it not discussed. Usually, I would say, ladies who've had a mastectomy or offered a mastectomy, they're always given the option whether they would want to have a reconstruction done at the same time or at a later stage. So, yes, there is always an option for having a delayed reconstruction. And again, what kind of reconstruction would be a feasible option for her would be decided by the surgeon who assesses her. So in the local area where she is, she can either be referred back to the breast clinic where the surgeons can see her, and sometimes they do a combined procedure with their plastic surgeons, or sometimes they do it on their own, depending on what option is available, because it's just not implants that can be used for reconstructing the breast. One can use their own tissue, either taking it from the back or from the tummy. So those options are there, and yes, she can be referred back to her local breast clinic to take things further. Now, with regards to, I thought I heard you say that she's been on tamoxifen for 15 years now?
Yeah, that's quite a long time, I would have thought.
It is quite a long time, and again, generally we say with extended treatment, it's up to 10 years. So I would ask this lady to go and get things clarified by her, from her GP, and it may be helpful to get her previous records sent to the local hospital so that they can look into this and advise her appropriately.
Yeah, absolutely. I think so. And I think to the sister who's written this question, I think it's really important. There are quite a couple of things here. There are complications with regards to what procedure you've undertaken. It's obviously been quite a major procedure, but you haven't been offered reconstructive surgery. And then in the process, you have moved. So something may have come about in your records that will make the clinicians here in this part of the country more aware of what your status is medically. And also, I think, is it important to give realistic expectations when we say that a lot of tissue can become quite fibrous at this stage over a period of about 15 years, Dr. Jafferbhoy? Would I be right in assuming that?
No, so after mastectomy, of course, what happens, the skin just fixes itself onto the chest wall because the tissue is all gone.
Sure.
And hence, the options are slightly different, and someone who's had radiotherapy, their options are different as compared to someone who hasn't had radiotherapy. And again, it's the body habitus. So there are lots of things that would be taken into account, and the general well-being of the patient, body habitus, and so on. So, and it's a whole spectrum of complications that are involved with undertaking these procedures. So I'm not trying to put this lady off, but equally it is very important that she has a good understanding around the whole process of reconstruction if she decides to go ahead with it.
Yes, that's right. And I would completely agree. So I really do. Our heart goes out to you, sister. And we really do hope that you're able to go to your GP when it's convenient for you, discuss your case at length, because you do need direction a little bit. And at the very least, some medical advice to tell you which speciality would be best catered for your need here within the Peterborough area, if that is where you are. You haven't said where you're located, but our heart does go out to you. Now, we're coming towards the last few minutes of our show, Dr. Sadaf, and I wanted you to talk just a little bit about the journey from a patient being told that they have a cancer to the treatment process that they are expected to go to, and the time frame. A lot of people are quite worried from the time that they have an investigation. But in our setup over here in Peterborough, I know that we've got a brilliant breast unit that will do, in some cases, an ultrasound guided core biopsy the same day, and often get results the same day, and a patient will be given, in most cases, a date for their surgery as to when they will be operated upon, which I think is really good. How does it work where you are?
I have to say that is really an excellent service that your local population has been provided with. So where I work, in fact, the places where I have trained, the general rule would be, and I'm just going to talk about the symptomatic patients, and these are the ladies who come to clinic complaining of a lump or having some symptoms with relation to the breast. So this is what we call as a one-stop clinic, where they would have mammograms, if need be an ultrasound scan, and of course if there's anything worrying, they'll have a biopsy. Mm-hmm. So from the time they have the biopsies, it usually takes about a week for us to get the biopsy results back.
Right.
So the idea is before the surgeons see them back in clinic, we have to go through their imaging, all the scans and the biopsy results with the pathologist, and then make a plan of treatment for her. So that takes about a week, and then depends whether they need surgery first, which is true for many patients, but in some cases we have to give chemotherapy before surgery.
Right.
And again, that's a quite complex decision, but sometimes we do that. So chemotherapy, if we were to give chemotherapy, that is usually up to 18 weeks. The treatment for chemotherapy is. Okay. And if they've had chemotherapy after the last cycle, we wait for about 4 to 6 weeks before they're offered surgery. On the contrary, if they have to have the surgery done, it's usually within 28 days from being told that they've got cancer.
Right. Okay.
And from then onwards, if they need chemotherapy, they will have chemotherapy. If they need radiotherapy, as well as chemotherapy, they will have chemotherapy first, and then they have radiotherapy. So, after, and getting the results from the surgery takes another 2 to 3 weeks.
Right, okay.
So altogether, a journey for a patient, for instance, if they've come to clinic, have been told they've got cancer, it's 4 weeks to the time of surgery, another 3 weeks before they get the results back. So it's almost 2 months before they've got the final results available to make further plans for treatment.
Okay, so that's sort of the window frame in which they can expect to have some type of a idea as to where they're being directed to and what's going to happen. And again, I think that is wonderful. Well, Dr. Jafferbhoy, we are extremely grateful to you on behalf of Salaam Radio for giving us such valuable time today in terms of everything that you've spoken about. And also to highlight that October is Breast Cancer Awareness Month, isn't it? Like you rightly told me.
It is. Yes. So we are expecting that with all the sessions that we are doing to make more awareness about breast cancers, I'm sure the ladies would be more carefully examining their breast.
Yeah.
And yes.
Okay.
So, no, thank you, Dr. Shabina, for having me over. I'm truly honoured.
No, and it's been wonderful to have your expertise on board, and we will have you, hopefully, inshallah, again. Thank you very much.
Inshallah. Thank you.
Assalamu alaikum.
Bye.
That was Dr. Sadaf Jafferbhoy, who gave us such a wonderful insight on the aspect of breast cancer. She spoke a little bit about screening, about examination, about the risks of breast cancer, and about the journey of a patient from time of diagnosis all the way through treatment. And we spoke a little bit about reconstructive surgery, and we have some comments which are very heartwarming. We have Mr. Amar Food Store and Halal Meat. Very informative show as always. We will miss you tomorrow. I'm so sorry, Bilal Bhai, that I cannot be there to your kind invitation. Next time you have to arrange it for me and I will be there. I'm at a very important meeting, but I promise you next time. And we have Sister Salma Yaqub. Very informative show. My sister, thank you very much for taking part and listening to our show as well. It's very kind of you. Now we have some announcements. Here we have new voices for BBC Radio Cambridgeshire. Could you be the new voice of Cambridgeshire? Now this is something that I'd look interested in, but I think I'll give the youngsters a bit more of an opportunity. So listen into this. Open auditions will be taking place on Saturday the 28th of September from 3:30 to 6 p.m. at the Key Theatre in Peterborough. So if you want to find out a little bit more about it, go on to bbc.co.uk/new voices. Now, this is something I'll take great pride in announcing to you. This is Life Learning CPR Skills. It's a course covers symptoms of heart attack, arrest, the recovery position and choking taught by local GPs. My very credible Dr. Azhar Chaudhry is going to be conducting some of these courses. A free session. It's open for men and women, separate seating for women at the Faizan Medina Mosque on Saturday the 28th of September after Zohar prayer at 2 p.m. and refreshments will be provided. Apart from that, a Healing Minds workshop series, Grow to Glow. It's a breakfast and interactive workshop, Sunday the 6th of October from 10 a.m. to 1 p.m. and at the Bull Hotel. Tickets are £30 and go onto the Salaam Radio page. Join me next week for another informative show with your very own Doctor Shabina Asad Qayyum. Assalamu alaikum.
Stay tuned to Salaam Radio after this short ad break.